It often starts quietly, a strange pressure in the chest, a wave of discomfort you are tempted to ignore. And right here is the moment that changes everything. Because in a heart attack, every single minute literally means heart muscle survival or death. And this is not just a dramatic statement. According to the American Heart Association, nearly half of heart attack deaths happen before the patient even reaches the hospital, which tells us the real battle begins at home, in the first few minutes, not in the emergency room. If you find this kind of life-saving knowledge helpful, take 1 second to like this video so more people can learn it in time. Now here is the key insight most people miss. The heart does not suddenly fail all at once. It is being slowly starved of oxygen as a clot blocks blood flow. And the longer you wait, the more irreversible damage occurs. Studies show that treatment within the first hour, often called the golden hour, can dramatically reduce mortality and preserve heart function. But after that window, the risk of complications rises sharply. This means your reaction speed matters more than your physical strength, more than your age, more than your previous health, and yet so many people hesitate, hoping the pain will pass, negotiating with their own symptoms, and losing precious time. So the real question is not, can you recognize a heart attack, but will you act fast enough when your body whispers instead of screams? People imagine a heart attack as a dramatic collapse with crushing chest pain. But in reality, many cases begin with subtle and confusing symptoms. And this is exactly why they are so dangerous. According to research published in Circulation, up to 1/3 of heart attack patients do not experience classic chest pain at all, especially women, older adults, and people with diabetes. Instead, they may feel unusual fatigue, mild shortness of breath, nausea, dizziness, or even a vague discomfort in the jaw, back, or stomach. And here is the insight that surprises many viewers. The body often sends warnings hours or even days before a major heart attack. But because the signals are not intense, people tend to dismiss them as stress or poor sleep. Studies from the American Heart Association also show that women are significantly more likely to present with these non-typical symptoms, which contributes to delayed treatment and higher mortality rates. So the real danger is not just the severity of the symptom, but how easily it can be misunderstood. If something feels off in a way that is unusual for your body, especially when multiple symptoms appear together, that is your signal to take it seriously. Because in heart health, clarity does not always come with intensity. Sometimes the quiet signals are the ones that matter most. Moments during a heart attack is not the pain itself, but the decision to wait. Because many people enter a phase of quiet denial, where they try to explain away what they are feeling, telling themselves it is just indigestion, stress, or fatigue. And this hesitation is incredibly common. According to studies published in the European Heart Journal, the average delay time before seeking medical help can range from 1 to 3 hours, and in some cases even longer, which is far beyond the critical golden window for effective treatment. Here is the key insight. The brain is wired to avoid panic and protect comfort, so it naturally looks for less threatening explanations. Even when the body is signaling danger, this creates a psychological trap, where the more uncertain the symptoms feel, the more likely a person is to delay action. And unfortunately, this delay directly increases the size of the heart damage and the risk of death. Another important point is that symptoms can fluctuate. They may ease and return, which falsely reassures people that the situation is improving, when in reality the blockage is still there. So the rule you need to remember is simple. If you even suspect a heart attack, do not try to confirm it on your own. Do not wait for it to become unbearable. And do not negotiate with the symptoms, because in this situation, acting early is never wrong, but waiting can be irreversible. The single most important action you can take is to call emergency services immediately. And this step is far more powerful than most people realize, because it does not just bring transportation. It activates a full medical response system before you even reach the hospital. According to the American Heart Association, patients who arrive by ambulance are treated faster and have better survival outcomes compared to those who arrive by themselves. And here is the insight that changes how you think about this moment. The ambulance is already a mobile treatment unit. Paramedics can begin oxygen therapy, monitor heart rhythm, and alert the hospital to prepare for urgent intervention, which saves critical time. Right here if you understand how important this step is. Take a moment to subscribe so you never miss life-saving health knowledge like this. Now, many people make the mistake of trying to drive themselves, or asking a family member to drive. But this can be extremely dangerous. Symptoms can suddenly worsen, leading to loss of consciousness while on the road, putting both the patient and others at risk. And even if nothing dramatic happens, you still lose precious minutes without medical support. When calling emergency services, speak clearly. Describe the symptoms. Mention chest pain or suspected heart attack, and provide your exact location. Then follow instructions and stay on the line, because in that moment, you are no longer alone. You are already inside the emergency care system, and that can make all the difference. One of the simplest yet most powerful actions is taking aspirin, and this small step can make a meaningful difference in survival. Because most heart attacks are caused by a blood clot blocking a coronary artery, and aspirin works by inhibiting platelet aggregation, which helps prevent the clot from growing larger. According to clinical guidelines from the American Heart Association, chewing a standard dose of 160 to 325 milligrams of aspirin at the onset of symptoms can reduce mortality and improve outcomes. And here is the insight that many people do not realize. Chewing the aspirin instead of swallowing it whole allows it to enter the bloodstream faster, which is critical in an emergency where every minute counts. However, this is not a one-size-fits-all solution. Aspirin should only be taken if the person is not allergic and does not have active bleeding or a medical condition that makes it unsafe. And that is why it should be seen as a supportive action, not a replacement for calling emergency services. Another common mistake is taking multiple medications at once in panic, which can complicate the situation, so keep it simple and focused. Call for help first, then take aspirin if appropriate. Because in this moment, small, correct actions performed quickly can protect more heart muscle than you might imagine. The period of waiting becomes a critical window where your actions can either reduce or worsen heart damage. And this is something many people underestimate because it feels like nothing is happening. But in reality, the heart is still under stress and needs support. According to clinical guidance from the American Heart Association, keeping the body at rest reduces oxygen demand and helps limit the extent of injury to the heart muscle. So the first priority is to sit or lie down in a comfortable position, ideally with the upper body slightly elevated. This position makes breathing easier and reduces strain on the heart. Now here is the insight that is often overlooked. Your emotional state directly affects your heart workload. Anxiety and panic can increase heart rate and blood pressure, which forces the heart to work harder when it is already deprived of oxygen. So slow, controlled breathing can actually be a protective tool. Another important point is what not to do. Do not walk around. Do not try to continue normal activities. And do not eat or drink excessively, as this can complicate emergency care. If possible, loosen tight clothing and ensure fresh air. And if someone is with you, ask them to stay close and monitor your condition, because even small supportive actions during this waiting period can help stabilize the situation until professional help arrives. The situation has escalated into cardiac arrest, and at this point, immediate action from bystanders becomes the deciding factor for survival. According to the American Heart Association, for every minute without CPR, survival decreases by about 7 to 10%, which means even a short delay can dramatically reduce the chance of recovery. But here is the empowering insight. You do not need to be a medical professional to make a life-saving difference. Hands-only CPR, performed by a bystander, can double or even triple survival rates. The technique is simple. Place your hands in the center of the chest and push hard and fast at a rate of about 100 to 120 compressions per minute, allowing the chest to fully recoil between compressions. Do not worry about being perfect, because doing something is far better than doing nothing. Now let us talk about AED, or Automated External Defibrillator. These devices are increasingly available in public places and are designed for anyone to use. They provide clear voice instructions and will only deliver a shock if it is needed. Studies have shown that early defibrillation combined with CPR significantly improves survival outcomes. So if an AED is nearby, use it as soon as possible while continuing compressions. Because in those critical moments, you are not just waiting for help. You are actively sustaining life. But the real advantage comes from preparing before that moment ever arrives. Because in an emergency, you do not rise to the level of your knowledge. You fall to the level of your preparation. And this is where a simple personal checklist can quietly become life-saving. Studies in emergency response behavior show that people who have a pre-planned, action, are significantly more likely to act quickly and correctly under stress. Here is the insight that changes everything. Hesitation is often not due to lack of intelligence, but lack of clarity. So your goal is to remove decision-making in the moment. Start by saving your local emergency number in your phone and making sure family members know it. Keep a list of your medications and medical conditions easily accessible. And if you are at higher risk, consider carrying aspirin where appropriate. Also, take a moment to mentally rehearse what you would do if symptoms appear. This simple visualization can dramatically improve reaction time right before we close. If you want more simple and practical health guidance like this, remember to subscribe so you stay one step ahead. And here is the final thought. You do not need to be perfect. You just need to be prepared. Because when seconds matter, the person who has already decided what to do is the one who gives themselves the best chance to survive.